can you put the invite graphic up, please?
Yeah, I will do that. We are live.
Okay, because it's showing up that we're live and it's already 16 people in the room.
Good morning, and welcome to Children Advocacy Alliance's inaugural Winter Summit. I am Lynn Perdue, and I proudly serve as the chair of the board. Our mission at CAA is to ensure that sound, equitable, and impactful policy is passed to the benefit of children and families in Nevada. While we recently celebrated 20 years of advocacy, I personally have been a part of Children's Advocacy Alliance since its restructuring about 9 years ago into the incredible organization you know today. As you may be aware, just last year, we brought on the fabulous Dr. Tiffany Tyler Gardner to lead CAA. She was our natural choice due to her years of advocacy for those most vulnerable in our state, as well as her ability to create and to lead a top-tier team. Our focus today will be our 2021 legislative policy preview. Our goal is to keep the community both informed and engaged in our current policy work. Additionally, we have the distinct honor of having United States Senator Catherine Cortez Masto as our special guest today. In addition to being someone for whom I have a tremendous amount of respect and admiration, Senator Cortez Masto has always been a strong supporter of our policy efforts, including around issues such as vaccinations, defending the Affordable Care Act, Medicaid, and working with minority communities to enhance healthcare access. We deeply appreciate the work she is doing and her willingness to be a part of today's forum. And now, I turn it over to our fearless leader, Dr. Tyler Gardner, who will be your moderator for today. As we proceed through the program, I strongly encourage you to get engaged, ask questions, and to help us do what needs to be done for the children of our great state. Thank you again for joining us today.
Thank you, Chairwoman Perdue. Good morning. And again, welcome to the Children's Advocacy Alliance's inaugural Winter Policy Summit. The Children's Advocacy Alliance is a statewide, nonpartisan, independent child policy advocacy organization dedicating its time and talent to improving conditions for Nevada's children and families in the areas of child safety, health, education, and economic well-being. We are thankful that you have joined us here today. Recent times have shown us that there is much work to be done. Today, you will hear about the challenges our children and families face and the ever-increasing need to broaden and strengthen our safety net for families. You will also hear what can be done to ensure that no child is lost. These resources will include a phenomenal showing of Starting at Zero, a film highlighting the urgency and benefits of early learning. You will also hear about several legislative opportunities to improve conditions for children from CAA's exemplary legislative firm, J.K. Belts and Associates, as well as some legislative leaders and champions of this work. As you consider the implications of the findings we will share, we hope you take note of the opportunities to move the needle and ask questions. Please be sure to enter your questions in the chat box to aid us in addressing any questions you may have, whether it's helping young learners overcome the digital divide, increasing affordable, stable housing, supporting health care access, or fostering economic well-being. There is a role each of us can play in ensuring Nevada's children have a brighter future ahead. Now, I'd like to turn it over to our Kids Count Initiatives Director, Dr. Tara Raines, who will share what we are discovering about the plight of Nevada's children and families. Dr.
Good morning. My name is Dr. Tara Raines, and I'm serving as the Director of Kids Count Initiatives at Children's Advocacy Alliance. CAA has partnered with the Annie E. Casey Foundation to provide and house data on the well-being of Nevada's children and families. At CAA, we provide this data to the community in our annual data book and report card. We also offer brief data sheets for each Nevada legislative district and ongoing data support through our policy briefing book and other data products. Using Kids Count data, CAA provides a report card of how Nevada is performing in the areas of health, safety, education, and economic well-being. As you can see, looking at these 4 areas, Nevada has earned a score of D, which is below average and suggests we are more surviving than thriving in these areas. CAA has a director working tirelessly to improve our performance in each of these areas, and you will hear from each of them today in this summit. Most recently, we received the COVID-19 Pain Points Report. This report surveyed families with at least one child under 18 in September and October of 2020 to see how they were managing during this global pandemic. What we learned about the state of Nevada's families was alarming. At the end of our review of these pain points, I'll be available to take any questions you have through the chat box. The Kids, Families, and COVID-19 report provided a glimpse into 4 areas or pain points. These points are food insecurity or not having enough to eat, housing instability or the ability to pay rent or mortgage, access to healthcare, and feelings of depression and hopelessness. We learned that Nevadans across all pain points are suffering more than the national average. I will share these pain points and hope you hear them as a call to action. 14% of families nationally reported they sometimes or often did not have enough food to eat. More heartbreaking, 17% of Nevadans reported they are in that same boat. That we have any children without enough food in our state is egregious. This report also revealed that a quarter, almost 25% of Nevada's families with children surveyed are not certain how they are going to make their next rent or mortgage payment. This is well above the national average, a disheartening 18%. It's also important to note that this data was collected before talks of ending the eviction moratorium. This global pandemic has highlighted innumerable disparities in our healthcare system. Based on this report, 13% of Nevada's families with children do not have healthcare. This does not include the number of people with employer-sponsored healthcare benefits that are likely to expire. In Nevada, this number may be a gross underestimate. As the final pain point, this report addresses mental health and well-being. It is no surprise that when asked about feeling down, depressed, and hopeless, more than 25% of Nevadans with children said they have these feelings often. We are very aware that the well-being of parents is crucial to the positive growth and development of children. It would be remiss not to highlight an overarching finding of this report. All of these pain points were amplified for communities of color. Black, Indigenous, Latinx communities are faring far worse than their white peers across all areas. As a priority, Annie E. Casey is imploring all communities to center racial justice and dismantling systemic racism as foundational in their approaches to repair after this pandemic and to support children and families. Overall, this report provided additional evidence that Nevada's children and families are in crisis. In our summit today, we will unpack these and other areas for legislative focus. At CAA, we know that data-driven advocacy and decision-making result in improved outcomes for children and families. We will be using data to support legislative initiatives and policy development in this session. You can find the full Kids Count Pain Points report and additional data tools on our website, caanv.org. To continue our summit, I would like to present Deshawn Jackson, Director of Safety and Welfare Policy at Children's Advocacy Alliance. Deshawn?
Good morning. My name is Deshawn Jackson. I currently serve as the Director of Safety and Welfare Policy with the Children's Advocacy Alliance. I will be discussing where Nevada currently stands when it comes to children's safety, while also highlighting some of the work the Children's Advocacy Alliance has done and is currently working on. Overall, pre-pandemic, Nevada fared average when it came to children's safety. As part of the report that was released last year that composed of 31 indicators, it was categorized into 5 categories: child maltreatment, youth homelessness, juvenile violence, child deaths and injuries, and substance abuse. Of those 5, 2 improved while 3 remain the same. Some data highlights from the report include, but please understand that this data is pre-pandemic. Nevada ranked 29th, 21st, and 38th for physical, sexual, and neglectful maltreatment, respectively. In 2019, Nevada placed 51st in the nation for child and youth homelessness, with 1,285 unaccompanied homeless children and youth. Nevada ranked 44th for juvenile justice, with 191 per 100,000 youth residing in juvenile detention, correctional, and/or residential facilities. In 2018, Nevada ranked 17th in the nation for child deaths, with 16 deaths per 100,000 children, a small decrease from 2016. This number is at the national average of 16 deaths per 100,000. Nevada saw no change in the percentage of youth who reported the use of any type of tobacco, remaining at the same at 11.5%, keeping our rank at 6th in the nation. However, the use of electronic vapor products ranked Nevada 6th out of 45 reporting states at 44.5%. When it comes to trends, we have seen a decrease in abuse and neglect calls to the abuse and neglect hotline. However, more recently, there has since been an increase in abuse and neglect calls that appear to be more severe in nature than previous. We are continuously tracking why there has been an increase in these severe abuse and neglect calls. There has also been a rise in youth receiving additional assistance with paying for rent, food bank usage, and etc. In a report released by the Field Center for the Children's Policy, Practice, and Research, found that 43% of the young adults who experienced foster care reported that COVID-19 had negatively impacted their living situation. 72% reported a money situation they would be able to be stable for no more than a month, while 21% reported currently being in a financial crisis. When it comes to their education, 67% reported that the pandemic impacted their educational progress or attainment. 56% reported clinically significant levels of depression or anxiety. This report was released at the early stages of the pandemic. So it is without a doubt that these numbers have increased in severity. Undoubtedly, this pandemic has impacted the child welfare systems and the lives of young people in ways we have yet to fully understand. The Children's Advocacy Alliance is working to improve the outcomes of youth who have experienced the foster care system as they transition into adulthood. CAA has launched a transition initiative where we have begun working with various organizations and community partners to assist young people transitioning out of foster care with job readiness and personal development skills. In addition, CAA hosts a quarterly child welfare network meeting that brings together child welfare, community, and allied partners to discuss and develop ways to impact the child welfare systems in Nevada. This alliance has recently expanded to Northern Nevada with the hopes of gathering the voices of not only the state's biggest counties, but the rural communities. At this time, I will turn it over to Annette Dawson Owens, the School Readiness Policy Director. Ms. Annette?
Good morning, and thank you, Deshawn. My name is Annette Dawson Owens. I serve as the School Readiness Policy Director at CAA. I'll be discussing the need for a cohesive, connected, pre-K through 12th grade, high-quality learning experience for every student. We must continually ask ourselves, how are all our children doing? And what supports need to be in place in order to deliver desired outcomes for students, families, and communities in the great state of Nevada. Nevada consistently scores near the bottom in measures related to education. Over the past 4 report cards, 8 years in a row, we earned an overall F in education. This is unacceptable. Our state report card looks at 10 indicators across areas such as school readiness, student achievement, high school completion, and funding. We must advocate for improving these outcomes and providing high quality schools for every student. Nevada's results were substandard prior to the pandemic, so we can only imagine the effects being even more exacerbated post-pandemic. We know that investing in high quality learning is the first rung in the education continuum. It is critical. Nevada is currently 47th in the nation for preschool enrollment, with 37.5% of 3 to 4-year-olds enrolled. This is a slight improvement from 36.7% in the previous year, but is not adequate. In addition, we have historically paid low wages and have overrepresentation in our communities, with a disproportionate number of childcare workers being from communities of color. The majority of brain development occurs in the first 5 years of life, and so the impact of early childcare and especially access to high-quality preschool experiences cannot be understated. 70% of individuals living in poverty do not utilize childcare services due to affordability, access, and other factors that need to be navigated in order to allow acquisition for all. We would invite you to join us in a call to action to advocate for investing in high-quality early learning experiences for all students, which levels the playing fields and gives every child a solid start. We must continue to invest beyond the early years, knowing that the return on investment is substantial, and cheaper than the alternative of remediation and rehabilitation that comes as a consequence of systemic underperformance. We must keep a watchful eye on the progress and outcomes being delivered consistently year after year in each grade level. Investments in the pre-K through 12 continuum lead to and support our long-term vision of career development and ultimately our economic recovery. After 13 years in our school system, all students should emerge prepared for whatever opportunities in life they desire, with a skill set that allows them to succeed, support themselves, and be productive citizens. Nevada moved down 2 spots to 45th for per pupil expenditures, investing $9,417 compared to the national average of $12,612. Multiple studies have shown that in Nevada, it would take an investment of at least $2,000 more per pupil than we are currently investing in order to adequately educate our students. That directly impacts our school readiness and ultimately our economic recovery. With our recent per pupil funding overhaul, we advocate for more money following each student and individuals getting the weighted funding necessary to support English language learners, students living in poverty, special education, etc. We advocate for our most vulnerable students, including those with special needs whose learning has been especially difficult and challenging during the pandemic. Often individual students' needs have gone unaddressed during the switch to virtual learning. In addition, 72% of parents with a child with a disability reported losing a job and income due to COVID, compared to 36% of those without a child with a disability. The Children's Advocacy Alliance supports initiatives to increase and afford access to high-quality childcare and pre-K for all students, to support family and parent education programs aimed at improving competence and competency for parents, as well as to ensure a highly qualified and adequately compensated childhood workforce. CAA has shared and invites you to share childcare provider stories throughout the pandemic to increase awareness and understanding for this essential component of our community's well-being. We have seen substantial closures in childcare facilities during COVID-19, and we know that maintaining spots for children in quality care supports their overall health, our families, and our future workforce potential. Childcare is directly tied to economic recovery. During the pandemic, many childcare sites have taken on the added responsibility of also overseeing the education of the older siblings of those enrolled in early childhood care. Again, the return on investment and benefit of such care for not only the children, but also the parents, workforce, and community is and will continue to be an essential, worthwhile component of Nevada's recovery. I would like to introduce my colleague, Priscilla Acosta, who will describe some of CAA's initiatives to combat education inequities, which are especially amplified during these difficult times.
Thank you so much, Annette. I'm Priscilla Acosta, and I serve as a Strong Start Prenatal to 3 coordinator for the Children's Advocacy Alliance. As Annette highlighted, the first years of life are crucial to brain development because of how fast a brain grows starting before birth and continuing into early childhood. We know the early years of a child's life are important and are linked to later health and development. Young children depend on parents, family members, and other caregivers as the first teachers to develop the right skills to become independent and lead healthy and successful lives. The Children's Advocacy Alliance is committed to health and early learning outcomes in Nevada. Through this commitment, CAA is leading the Strong Start statewide collaborative and the Work for Nevada Strong Start grant through the Pritzker's Children's Initiative. Our collaborative is composed of over 50 individuals representing over 30 organizations statewide, ranging from state departments to parent advocates, all dedicated to improving access and increasing program utilization for prenatal individuals and infants and toddlers who are below 200% federal poverty level in Nevada. For reference, the federal poverty level is an economic measure used to decide whether the income of an individual or family qualifies them for certain federal benefits and programs. The Department of Health and Human Services updates the poverty guidelines, illustrating the set minimum amount of income that a family needs for food, clothing, transportation, shelter, and other necessities once a year. So for reference, 200% federal poverty level for a family of 4 in 2020 was $52,400. The Nevada Strong Start Plan was built around 4 policy areas we believe would have the biggest impact on pregnant individuals, infants, and toddlers. The 4 areas include 1, increasing the number of pregnant individuals, infants, and toddlers utilizing services to support healthy development. 2, increasing utilization and quality of community-based early childhood supports for families with young children. 3, increasing capacity and utilization of quality childcare programs servicing infants and toddlers. And 4, increasing statewide capacity and understanding of the need for a comprehensive early childhood focus. I'd like to take this time now to highlight some of the grant proposed achievements. First is having an additional 2,215 infants and toddlers who are below 200% federal poverty level utilize well child services under a 12-month continuous eligibility of Medicaid by 2023. By 2025, we are aiming to have an additional 1,908 pregnant individuals who are below 200% federal poverty level on Medicaid utilize early prenatal care through expanded presumptive eligibility. Another is by 2023, having an additional 8,500 women who are below 200% federal poverty level on Medicaid receive access and utilize postpartum care services through Medicaid with access to 12-month postpartum coverage. Next, having an additional 100 lawfully residing pregnant individuals who are below 200% federal poverty level utilize Medicaid without the 5-year wait period requirement by 2023. By 2025, we hope to have approximately 11,400 new parents who are below 200% federal poverty level gain access to a community health worker with an early childhood certification and a first touch program to conduct health assessments, screenings, referrals, case management, and related services. And last but not least, by 2023, we aim to have an additional 450 infants and toddlers who are below 200% federal poverty level gain access to high quality childcare through the establishment of an additional 450 contracted slots for childcare subsidy at 3, 4, or 5-star centers by 2023. This is no small feat, especially given the current state Nevada finds itself in. However, the Children's Advocacy Alliance strongly believes in investing in children and believes every one of us can play a role in improving outcomes for young children. Whether you're a legislator who can push for health measures, as our Director of Health Policy will highlight, or a parent who can advocate for their child, we encourage each and every one of you to join our statewide collaborative and become a champion for families and children of Nevada. I'd now like to pass it over to my esteemed colleague, Dr. Kelly Baumgartner.
Thank you, Priscilla. My name is Dr. Kelly Baumgartner, and I serve as the Director of Health Policy at CAA. Overall, Nevada fares poorly in promoting and protecting the health of our children. While during COVID in particular, there are a myriad of children's health issues we could explore, I'd like to focus on one of our top priorities, access to healthcare, which I have been studying in depth with the support and assistance of our interns, Ro Gill, Hailey Dobbs, and Natalie Rodriguez. When discussing access to care, I'd be remiss if I didn't emphasize that due to the nature of data collection and dissemination, any numbers you may find or that I may mention today are from 2019 or earlier. So the data is all pre-COVID, and it's likely significantly different now. What we do know is the number of Nevadans without insurance is growing. Prior to COVID, approximately 6% of American kids were uninsured. Nevada was worse at 8%, for a ranking of 45th nationally. According to a recent report, those numbers have doubled in recent months. As COVID vaccines are rolled out, uptake will be a vital piece of our economic recovery. Previously, our vaccine rates were 20th in the nation, but Nevadan experts agree vaccine hesitancy and fear of seeking care are increasing in our state. Families of mixed status often avoid medical care out of fear of public charge, and undocumented children and families don't qualify for COVID-related Medicaid unless their health is in severe jeopardy. 36% of Nevadan children have at least one immigrant parent, 1/3 of whom are undocumented. We have to diagnose and treat everyone with COVID-19 if we want to slow the spread. The virus doesn't care about ethnicity, income, or immigration status. While COVID testing is now widely available at low or no cost, non-emergent treatment like doctor's visits and prescriptions is not. If undiagnosed, COVID-positive individuals will continue to work, shop, dine, and spread the virus in our communities. Whether the case is ineligibility due to immigration status or loss of employer-sponsored health insurance, the result of a lack of coverage is the same. Healthcare is delayed until there is an emergency. In the first 5 months of the pandemic, nearly 8 million Americans lost a job that provided employer-sponsored health insurance. In Nevada, where our unemployment rate is the second highest in the nation, we've certainly seen large losses in coverage. There are disparities within that job loss, as women of color were 12% more likely to experience pandemic-related layoffs and furloughs than white women, and all women were much more likely to experience those layoffs than men. Many newly uninsured Nevadan children qualify for programs like Medicaid or CHIP, but parents may be unaware of their eligibility or unwilling to enroll due to stigma. Nevada Medicaid currently does not allow for 12 months of continuous eligibility. So when changes in income or living arrangements occur, which we know happen a lot during a pandemic, kids cycle off and on Medicaid, a process called churn, repeatedly. This is harmful because it produces gaps in care, skipped well checks, and it disrupts the continuity of care for children with chronic health conditions. In 2019, we ranked 51st for the percentage of children with a medical home and 48th in patient-provider ratios. Once again, I must stress this data is pre-pandemic, and these numbers have been exacerbated by economic downturn and job losses. Decreased access to care produces adverse health outcomes for Nevadan children of all ages, even those who haven't been born yet. Previously, nearly 1 in 10 Nevadans who gave birth received late or no prenatal care. While this number is alarming, it doesn't reflect additional disparities in BIPOC, low income, and rural communities. In Laughlin, for example, only 1 in 3 pregnant women received early prenatal care. In Washoe, that number is 1 in 5, likely due to a lack of access to care in its rural regions. Community health workers, trusted, culturally competent, cost-effective, and certified professionals who work under the supervision of doctors and physician assistants, reside in the areas they serve and can help bridge the gaps between prenatal care and rural residents. Babies whose mothers do not receive prenatal care are 3 times more likely to have a low birth weight and 5 times more likely to pass away. Birth weight is critical because during the first month of life, it is the greatest determinant of infant mortality. During the first trimester of pregnancy, healthcare providers can detect and treat problems, often before they negatively impact fetal development and maternal health. Increased access to care increases utilization during pregnancy. CDC data indicates significant increases in preconception health conversations with providers, folic acid consumption, and postpartum contraception when women had access to Medicaid. Medicaid coverage currently ends 60 days postpartum in Nevada. This is concerning because 1/4 to half of all antenatal pregnancy-related deaths occurs 6 weeks to 1 year postpartum. Pre- and postnatal care and childhood access to care are unique instances in which expanding coverages decreases not only adverse health outcomes, but also cost. In 2007, the Institute of Medicine calculated a preterm birth results in an approximately $33,000 bill, while a full-term birth costs about $3,300. Postpartum care is essential for the treatment of anxiety and mood disorders, often associated with pregnancy and birth, which studies indicate may cost over $14 billion when untreated. There are healthcare-related BDRs this session that increase access and, over time, decrease costs. CAA convenes the Nevadans Together for Health Access Coalition, a group of like-minded stakeholders, retirees, legislators, nonprofits, anyone interested in defending and protecting Medicaid and the ACA, and we invite you to join us. Please assist us in advocating for our children's health by strengthening and defending Medicaid during COVID and beyond. Thank you for your time today. I'd now like to introduce my colleague, Dr. Sandra Owens.
Thank you, Kelly. I am Dr. Sandra Owens, Economic Wellbeing Director at CAA. I will be discussing 4 economic well-being indicators as identified in the Nevada Kids Count report card. These indicators are employment, income, housing, and poverty. Nevada received an overall grade of D+ for economic well-being. This is improved from our prior grade of D. Nevada ranks 40th in state rankings on economic well-being, as per the data of the Annie E. Casey Foundation. I will share some data and insights that will provide you with context and content for our advocacy priorities during the legislative session. Indicator number 1, employment. The following facts and figures will illustrate the seriousness of the economic matter and the need for legislators to help increase employment opportunities for Nevadans. The Department of Employment, Training, and Rehabilitation reported Nevada's unemployment rate at 14.2% on December 31st, 2020. There have been almost 785,000 initial claims for unemployment benefits in Nevada since the week ending March 14th, 2020 until the week ending December 26th, 2020. There were over 7,000 initial claims in the final full week of claims for December. These new claims came during a time of traditionally celebratory occasions such as Christmas, Hanukkah, Kwanzaa, and occasionally Ramadan. Thankfully, the CDC eviction ban has been extended until the end of January, and Nevada has extended the eviction ban until the end of March. These measures will provide a little more relief for those families who qualify. Nevada's Pandemic Emergency Unemployment Compensation Program, PEUC, which provides up to 24 weeks of benefits to individuals who have exhausted their regular unemployment benefits, saw almost 96,000 claims filed in the final week of December. Nevada's State Extended Benefit Program provides up to 20 weeks of benefits to individuals who have exhausted both their regular and PEUC program benefits. Nevada saw almost 24,000 claims filed in the final week of December. The Pandemic Unemployment Assistance Program, which provides up to 57 weeks of benefits for self-employed, 1099 contract workers, and gig workers, saw a total of almost 785,000 initial claims filed since March 14th. Nationally, 42% of families with children reported losing a job or income due to COVID-19, compared to 27% of families without children. These job/income losses were disproportionately felt by parents of children with disabilities and parents of young children. 4 times more women than men dropped out of the labor market in September due to COVID-19. Americans will use their often meager 2020 base pay periods to determine unemployment insurance eligibility for assistance in 2021 should they need it. Thus, Congress should immediately make provisions to waive and later permanently modify policy such as the prior year wages requirement so that past policy does not impede future financial support that is needed by the long-term unemployed. This is the time for state and local legislators to focus on creating good jobs that provide a 2021 living wage, and they should help ensure family-friendly employment policies. Legislators can leverage their relationships with philanthropists and business owners and other Nevada residents to facilitate innovative means to provide grants to nonprofit organizations that supplement the social services of state agencies. Indicator 2 is income. In 2020, the Center for Disease Control and Prevention published findings from a study of low-income households with children living in 4 US states. Overall, 93% of respondents reported being food insecure. 80% were concerned about being infected with COVID-19. 73% reported concerns about financial stability. 43% of survey respondents were concerned about employment. 36% had concerns about healthcare access, and 31% were concerned about housing security. Better understanding the social needs of our most vulnerable families with children is critical now more than ever, especially because of the health disparities associated with COVID-19 prevention and treatment. Data from the Century Foundation shows that in July 2020, 52% of young adults between the ages of 18 and 29 years old have moved back in with family due to financial reasons, such as losing their service or retail jobs during the shutdowns. Are their colleges and universities converting to remote learning? Are the closing of college housing? Prior to the pandemic, Black and Native American young men had higher unemployment rates than their peers. And so the economic impact on these men and their peers will need to be addressed now and over the long term. For example, new legislation should include special outreach, education, employment, and retention efforts to ensure stable income for young adults in Nevada. Young adults are the future of Nevada and its economic well-being. Indicator 3 is housing. COVID-19 is causing the most catastrophic economic crisis since the Great Depression. And thus, we must prepare for short and long-term spikes in housing prices, rental rates, evictions, and foreclosures. Landlords need to adjust their pre-2020 leasing requirements, such as a person needing excellent credit ratings in order to qualify for safe, quality housing in good neighborhoods. California used CARES Act funds to purchase hotels and motels that shuttered due to the COVID-19 pandemic. And they converted the properties into homes for homeless people. And they provide on-site social services such as counseling and job readiness. Nevada legislators should help facilitate public-private partnerships such as these and convert vacant hotels in Nevada. For example, the Fiesta and the Texas and others, and vacant motels, apartments, and heretofore commercial buildings into housing for low-income working families. Charitable organizations are on the front lines of serving families, and they need more funds to address the wide and growing needs related to obtaining and retaining housing. In recent months, I have seen the joy of families who are told they qualify for CARES Act payment of their late rent, mortgage, or utility bills. Regrettably, I've also been present when a family is told they don't qualify. And I've been present when a nonprofit organization has to tell callers over and over if the funds are expended. Nevada policymakers should renew their efforts to help Nevada organizations apply for and receive more federal and private grants and contracts to help needy Nevadans stay housed during this pandemic and during the economic recovery period. Impact 4 is poverty. A new report from the Georgetown Commonwealth Fund shows that Medicaid coverage of children and pregnant women is associated with improved health and lower rates of disability across the lifespan, higher educational attainment and greater financial security across the lifespan, and a strong return on government investment. The report explained how every $1 reduced cut in Nevada state spending on Medicaid will result in an additional loss of federal Medicaid funding of $2.28 for Nevada. Thus, Nevada cannot afford to cut Medicaid. and the expansion of Medicaid enrollees and utilizers, especially in family-friendly companies, should be a priority for Nevada. Income support programs like the Supplemental Nutrition Assistance Program, SNAP, and cash assistance are proven to increase health and economic opportunity for families and communities overall. The new COVID-19 relief package provides $26 billion to help combat food insecurity and will temporarily increase individual monthly SNAP benefits by 15% for 6 months. This is great news. However, we should ask Congress to permanently increase SNAP rather than only enacting temporary extended benefits. Now that you have some context and content regarding what CA does in the areas of economic well-being, health, education, and children's safety, we are now calling on you to join us in our advocacy efforts. Contact us via phone or email, and we will respond to your calls and emails as soon as possible. We are a resource for legislators and all stakeholders in Nevada. I will now turn the time over to Dr. Tyler.
Thank you, Dr. Owens. Now we'd like to take a moment and respond to some of the questions we've received in the chat. It appears that the first question is a question about understanding the disproportionate nature of the impact of this pandemic, particularly as it relates to unemployment and parents with children with special needs, as well as what parents can do to advocate for themselves and their families when they find themselves impacted by that issue. So let me just read that question directly. It appears that there is a disparity in families leaving the workforce as a result of their children having special needs. And to what do you attribute it? Is it the nature of the job or work? And then I think the secondary portion of the question is what can be done about that? Dr. Owens, Annette, are you all seeing disparities?
Yes.
You gave word returning your call. I said that you were going to be going to work remotely, and then just to be on the lookout for a private number if you need to call. Yeah, great. Okay. Yep.
Yes, we are seeing disparities. If we go to the Pulse report, the census report that came out last fall, you'll be able to see a little bit more about what the disparities are and why. So we'd have to go back to that data to see what the causes of those disparities are, whether it was childcare, whether it's the homeschooling that's required, whether it's not getting access to the court services and allied professionals that the families are used to. We have to really go back to that study and kind of look at their charts and data and answer that question.
And I'd like to add that Dr. Owens' report also stated that 40% of families with children report losing a job or income compared to 7% of families without children. And the job income losses were disproportionately felt by parents of children with disabilities and parents of younger children. And as we stated, 72% of the parents with the child with a disability reported losing that job income to COVID, versus 36% of those without a child with a disability. So the demands on parents seem to be increasing, and women are 4 times more affected by this. So what we need to do is make sure that we have supports in place for those special education students and make sure that they are priority, are most vulnerable, that they are getting the education that they need so that those families won't be adversely affected and will be able to go back to work and do the work that they need to do as well.
Wonderful. As a follow-up to that question, I believe we have a parent advocate ask, well, how can parents get engaged or advocate for themselves and their children? Are there opportunities to do so at the Children's Advocacy Alliance? Annette or Priscilla?
Sure, I can start that. The Children's Advocacy Alliance partners with the Nevada Institute for Children's Research and Policy and the Nevada Association for the Education of Young Children for the Strong Start Parent Ambassadors program. And this program teaches parents how to engage in local policy and advocacy activities to help support the issues relating to the well-being of Nevada's children, including the support for early childhood education. Participants will learn about the importance of advocacy, how to use it in their everyday lives, and will participate in activities and training throughout the year with a meeting each month. And anyone who is interested in that can connect with us via our website, and we will connect you with those advocacy efforts.
Thank you, Annette. And now I believe we have a question regarding the impact of the pandemic for youth transitioning from the foster care system. Mr. Jackson, are you there? I believe the question is related to
Yes.
Recent reports have indicated that as high as 65% of foster youth lost the employment that they had prior to the pandemic. I know that there are a number of efforts underway under your policy area, under the transition initiative that will launch. Can you talk a little bit about specifically what strategies or things are happening to address the needs of youth aging out of the foster care system?
So some of the things that we're currently working on when it comes to youth that are transitioning out is workforce development. So what we found was that many of the young folks that were transitioning out of the system did not have job training skills. And so to ensure that they are just as competitive as anyone else, we are looking to equip them with those job readiness skills. So we've partnered with different organizations to launch this transition initiative, which really focuses on equipping them with these skills, partnering with Goodwill and a lot of other organizations that would provide a paid opportunity for the young folks as they transition out.
Thank you, Mr. Jackson. Now we have a question about maternal health and prenatal care. Dr. Bumgarner and Dr. Rains, could you share more about what is happening at CAA in relation to maternal health, particularly the recent efforts around birthing equity?
Hello. At CAA, we recently, last week actually, had a panel with local experts, doulas, midwives, and a birth center owner to talk about the continuum of care in Nevada and the importance of offering birthing persons choice in where they deliver and whether or not they want to participate in interventions during the childbirth process. And so our efforts are to both bring awareness to the fact that there is a continuum of care option and also promote policy that offers access to birthing persons all along this continuum.
Thank you, Dr. Rains. Did you have any additional comments about birthing equity, Dr. Bumgarner? Maybe even the recent discussion around carceral births?
Thank you. Yes, we actually hosted the meeting that Tara just spoke about through the Nevadans Together for Health Access Coalition. And in the beginning of February, we will be hosting a similar meeting with a focus on carceral birth, which means individuals who are pregnant and or deliver a child when they are involved with our prisoner jail system here in Nevada. It's an interesting area because not a lot of research has been done on it, and it's something that we at CAA would like to explore further in this quest to make sure that everyone has access to, as Dr. Rains referenced, the birth of their choice and the care of their choice. So it's something you might be interested in learning more about. Please feel free to contact us at Nevadans Together for Health Access. We have a Facebook page or a website, and we'd love to have you join our meetings.
Thank you. Now I believe we have a question about the Pritzker initiative. Particularly, there is a movement afoot to really make sure that we have a statewide framework for prenatal to 3 services and supports. And as a part of that work, there's been some discussion that highlights the fact that we're all in it together as it relates to our health in this pandemic. And if I could have Dr. Bumgarner speak to this, you have recently noted that there's disproportionate healthcare access, and particularly the ways in which immigration status or or gender or race have been implications. Could you all speak to that? Like Priscilla, could you share kind of how many folks have been convening to make sure that there's a framework for ensuring that families have services? And Dr. Bumgarner, could you share more about some of those disparities and the why we are hoping folks will support things like presumptive eligibility or continuous eligibility?
I'll speak first to the disparities, and then Priscilla can discuss what we're doing to address them. Latinx children in particular are more likely to be uninsured than any other racial group in Nevada, with an 11% uninsured rate. That's significantly higher than white and Black children, who are both around 6%. So when we talk about a lack of access and a lack of healthcare coverage, we need to really dive into the data and find statistics like, for example, BIPOC women are as many as 5 times more likely than white women to pass away from pregnancy-related complications or during childbirth. So that's part of what we do at CAA, is explore that data, find out what the disparities are, and then look at a way that we can increase equity and access for individuals who might be underrepresented. Dr. Tyler Garner, you mentioned individuals who have a difficult time accessing care because of immigration status. This is an area we are particularly interested in right now with COVID. If individuals do not have health insurance, they're a lot less likely to see a doctor with a mild or moderate case of COVID. They may be fine and recover from the virus with relative ease, but we have to think about that period in which they are contagious and able to spread the virus to others who might not be so fortunate and might not have a mild or moderate case of the virus. So when we think about undocumented individuals or those who may not qualify for Medicaid and CHIP at this point in time, we really need to understand the implications aren't just they can't see a doctor for a well check or for a minor ailment, but it may be a COVID-related implication or a severe health condition that they're unable to get treatment for. And that's really concerning.
Thanks for that, Kelly. I also just want to highlight that for our Children's Pritzker Initiative, the Strong Start Statewide Collaborative, we are also making sure that any decisions that we make when it comes to our work are informed and equitable choices. So we've worked really hard to make sure that we have representation from across the state, and that's just not North and South. We're really did some hard reach out and efforts to rural communities as well as our tribal communities and Indigenous communities. So I'm really proud to say that we are working on a partnership with the Intertribal Council of Nevada and a number of other Indigenous communities throughout our state. And as Dr. Kelly mentioned, just making sure that we have that representation when it comes to underserved and underrepresented populations. So that way, when we are not just telling them what's best for them, we're hearing directly from the communities. And one area that I would like to highlight is our work with community health workers to make sure that the individuals that will be going out into those communities are members of the community, so that anyone that they're working with feels comfortable and safe with those individuals who are reaching out to these families.
Thank you, Dr. Bumgarner. Thank you, Ms. Acosta. Another question that has came up is the discussion around our economic recovery and the role that our childcare industry will play in that recovery. Ms. Owens, do you have some thoughts about that? Like, what is the state of our childcare industry now? What have we seen over the course of this pandemic, and what resources may be needed?
Thank you, Dr. Tyler Gardner. During this pandemic, we've seen that we have 425 active facilities for childcare. 16 are inactive, and 35 were permanently closed for reasons such as financial hardships, lack of business. Some were planning on retiring. Facilities are continuing to submit amendments to raise the ages of children they serve, as well as increasing their school capacity. Facilities are remodeling and moving schools around to accommodate these school-age children, and routine inspections are occurring. So we want to make sure, again, that we have all the supports necessary in place so that these child care facilities can stay open. They are feeling an increased role that they're playing in taking care of these siblings. And so they're very important to the economic recovery for our parents, and that they have the supports that they need in place.
Thank you, Dr. Owens. Now, if I could ask, I think we have a question about economic well-being and how it is framed as including a number of areas. Dr. Owens, some have highlighted the impact of our housing crisis, particularly the moratorium, or the continuing challenges around food insecurity as one other area of economic well-being. As a licensed clinical social worker who has seen ways in which these things are interrelated, whether it's housing stability or food insecurity or the impact of employment, if you could identify maybe just 2 to 3 things that any community member can do or should be concerned about as this pandemic continues to unfold. What are just some of the thoughts that come to mind for you?
Well, economic well-being is all-encompassing, and so it's interrelated with all of the things we've talked about today: housing instability, food insecurity, whatever you can do to help your local nonprofits, whatever you can do to advocate and testify during the session, and try to get our legislators to pass new legislation or revise existing legislation that will strengthen the community supports, the state services that are provided by the state agencies and local agencies. We all need to work together and to get creative and to think about problem solving and to do as much as we can in terms of volunteering, in terms of donating money if we have those resources. There are a lot of families hurting economically, and when you're hurting economically, it impacts your health, your mental health, your housing security, your parenting, all of the different things are interrelated. So whatever we can do as Nevadans go into this legislative session to support our legislators and tell them our stories, tell them what's going on with us, so they can try to look at what policies they can change and legislation they can pass and what relationships they can leverage with philanthropists and their supporters and funders and whoever else is willing to help Nevadans during this economic crisis.
Thank you, Dr. Owens, and thank each of you for answering these questions. We encourage you to continue to put your questions in the chat so that we may respond. But now I'd like to pause because I have the distinct honor of you, Dr. Owens, special guest today. Our special guest is United States Senator Catherine Cortez Masto. Senator Catherine Cortez Masto is a Las Vegas native and a University of Reno graduate. She served 2 terms as our Attorney General of Nevada. And in November of 2016, Senator Masto made history by becoming the first woman from Nevada and the first Latina ever elected to the United States Senate. During her time as Nevada's top prosecutor, Senator Masto became well known as an advocate for children, seniors, women, and others. She's worked closely with law enforcement to keep Nevada children safe and is an advocate for Nevada's working families. Senator Cortez Masto, thank you for joining us today and welcome.
Well, thank you. I am so excited, Dr. Tyler Garner, to join all of you at the Children's Advocacy Alliance. So good morning to everyone. I am a big fan of what you do. I had the fortune of knowing the founding members of the Children's Advocacy Alliance, one of them being my sister and some really dear, dear friends. And I so appreciate all of the good work that you have done over the years in our community and will continue to do so. I want you to know that because you have a friend here we are here in this office to be your advocates to help you get resources into our community where there is a need. And we know there are so many challenges right now, even before COVID hit, but now because of this pandemic, we see so many families and children stressed and in need right now. So thank you for everything you're doing. Thank you for the wonderful staff at Children's Advocacy Alliance for putting this summit on. It's not an easy thing in this new Zoom world we're all living in, as we all live in these little boxes, but thank you for all the good work. So here's what I would love to do. Talk a little bit about the most recent coronavirus relief package that we passed, and then going into the new Congress, what some of the priorities that I have set forth to address are helping our children in our community, our families. And through all of this, please know we want to hear from you as we move forward. We want to make sure your voices are heard. You're the experts. We need to know what we're doing here at a federal level or continuing to support the needs in our community. And you all are the experts at that. So thank you for always reaching out. So let me talk a little bit about the COVID relief package. This year's package was a little different because we were trying to get everything done towards the end of this Congress. A Congress is 2 years. And so we just finished the 116th Congress, and we were moving into a new Congress, which is the 117th. So we had to finish everything, get everything passed. Otherwise, it would have required us to reintroduce everything again. So that's why you saw us putting a lot of things together, and particularly in this case, we put 2 packages together, the appropriations package for all of the federal government, and then we put attached to that the coronavirus relief package, the other package, which is really, I want to say, the 5th package that we have passed in Congress. So let me talk a little bit about COVID relief, because in that package, there is $900 billion in additional relief going into the states. Now, we all know that's not enough and more needs to be done. The goal here was to have this money as a bridge as we transition into the new administration, the new Congress, and the bridge being a 4-month period. We would look again maybe in February or March to see what the additional needs are, and then pass another relief package based on the needs in our community. So in this package, let me break this down, because I'll talk a little bit about just the healthcare piece, economic and food security, education, and broadband. So let me just talk about healthcare first. This COVID relief package includes funds to obviously bring the pandemic under control, including money for vaccine distribution, for COVID-19 testing and tracing, and other public health activities. It has also increased overall funding to the Department of Health and Human Services, including more money for early childhood care and education, for mental health, as well as money to the National Institutes of Health. So that includes $10.7 billion for Head Start. That's an increase of $135 million from last year's funding. It includes $5.9 billion for the Child Care and Development Block Grant. That's an increase of $85 million. And as you know, this fund enables the state of Nevada to subsidize childcare for working families with low income. The bill also includes $35 million for mental health block grant programs, crisis care initiative, and an extension of the Certified Community Behavioral Health Clinic funding through 2023. And that's to offer a comprehensive range of mental health and substance use disorder services to vulnerable individuals. And I know you know this, currently Nevada has 4 of the CCHBCs across the state. The omnibus bill also stops surprise billing, and it includes legislation that I had introduced to enhance transparency in healthcare by requiring reporting about drug pricing and contracts to the congressional advisory agencies. And if you want any more information on that, we can get specifics to you. The bill also addresses the economic and food insecurity that we see across the country. The omnibus supports families economically by extending unemployment assistance, offering emergency rental assistance, strengthening the Paycheck Protection Program, and offering additional stimulus for families and children. There's considerable nutrition and food assistance in this bill as well. It includes $114 billion in SNAP benefits and $25.1 billion for child nutrition programs to provide free or reduced price school lunches and snacks. In addition, it authorizes $6 billion in discretionary funding for the special supplemental nutrition program for women, infants, and children, and an increase of $80 million for the commodity supplemental food program. It also includes support funding, extending current funding of the TANF and the Child Care Entitlement to States and other related programs. It includes healthy marriage and responsible fatherhood grants through the end of fiscal year 2021. And then finally, if we're talking about education and broadband, the bill includes $40.6 billion for K through 12 education programs throughout the nation. It also sets aside $3.2 billion for an emergency broadband benefit for low-income Americans, $635 million for USDA's Reconnect Rural Broadband Program, $250 million in telehealth support, and I had a bill, Access Broadband Bill, that was included to help communities better obtain federal broadband and funds and better track those through coordination of federal agencies. So there's much more in COVID relief. If you have any specific questions about those, please reach out to my staff. I have a number of staff on the call with all of you today, and just reach out and let us know. The other thing I want to make sure is as we go through this next 3 or 4 months, and we see how this money is utilized and the need, if there is a better way, or if there is a different avenue or venue for us to bring relief, please let us know. You guys are on the ground, you're hearing how the money's being utilized, you're seeing the gaps, you're seeing the need. So if we're missing something as we go into a next conversation about future relief, please talk to us. We want to get this right. We want to make sure that money gets to where it's needed. And then moving forward, I've got priorities moving into this Congress that we're going to focus on. A lot of it has to focus on the expansion and protection of the Affordable Care Act, but also strengthening resources around mental health. I cannot stress this enough. I have a bill I've introduced, behavioral health services, substance abuse. We in Nevada, we cut those services in the 90s. We have never caught up. And so we've got to address behavioral health crisis that we have in Nevada and across this country. That is a priority for me, and it is a bill that I've introduced, and we are going to be very vocal about this moving forward. We're also going to be looking to expand access to refundable tax credits, like the Earned Income Tax Credit and fully refundable child tax credit. I sit on Senate Finance. It gives me the ability to address those issues that I just talked about, along with sitting on banking and affordable housing. Affordable housing, as you all know, is a #1 issue we have in the state amongst so many others. It is a priority for me and many of us that are in banking and housing. Now, as we go into the new Congress, because the Democrats are taking control, we control the agenda. We control the agenda going into these committees. And so I'm already talking with my colleagues who will be the committee chair, and particularly on banking and housing, Sherrod Brown, who will be the chairman. He and I are focused, and so many of us on that committee, around affordable housing and how we address those needs throughout our state and this country. So please know that. Any other ideas? We've got so much more for you. So to me, this is one of many conversations we're going to have. I want to make sure you know what we're doing, but also to hear from you and make sure we get this right. Any new legislation that we need, any tweaks to the existing legislation or changes, please let us know. My goal is to fight for those resources to bring that money and that support into our community to support what you do every day. So with that, let me just say thank you. I so appreciate everything that you are doing in our community for our children and families, and you got my support.
Thank you so much, Senator Masto. Thank you for being a tireless advocate, champion, and leader for Nevada's families and children. Thank you for your vision for the opportunities that we can have if we link arms together around this issue. And we look forward to working with you in the future. Thank you for your time today.
Thank you, everyone. Stay safe.
Thank you. And now I believe we will hear from J.K. Belts and Associates.
Good morning. Our team is delighted to be here to share with you the 2021 legislative priorities for the Children's Advocacy Alliance. Leah, Valerie, Sydney, and I will be working hand in hand with the legislators who have shaped and developed the legislation we will be discussing. And we are excited that several of them are joining us a bit later to tell you about their efforts on behalf of Nevada's children and their families. But before we get started, I would be remiss if I didn't thank those who helped to develop this agenda. We appreciate the work of Denise Tanada and Jared Busker, who walked in these shoes before us and laid the foundation for the discussion in 2021. We have grabbed the baton and will forge ahead. But before we look to 2021, we will briefly examine the past to review the 2019 bills because several of them laid the path for our work today. I would like to introduce my colleague, Valerie Balin, who will walk you through these bills. Valerie.
Good morning, everyone. My name is Valerie Balin. I work with JK Bells and Associates and the Children's Advocacy Alliance. Super excited to be here. If I don't sound like it, I'm a little bit under the weather, so please forgive me. But I'm going to be going ahead and giving a really quick highlight of the 2019 session and a high-level overview of some of the bills that were passed relating to children. So on screen right now is a handout that we have available. It lists some of the bills along with reports that came out of the bills. And we can get that hopefully to the participants later if you guys wanted to do more research and actually read the bill text and just get a more comprehensive view of that, that's available for you guys. So going into some of the bills, we could go to the next slide. Thank you. We're going to start off with child safety. AB 498. This was a bill brought forward by Assemblywoman Monroe Moreno, and this would allow an expansion of resources and financial assistance for fictive kin who are appointed as legal guardians for children in foster care. This is to help raise and care for those children. So in case you don't know, fictive kin is a caregiver who is not related to the child by blood or by legal means. So perhaps a really close family member that knows the child all their life, they'd be able to receive these resources, which is really great for the child and great for creating a supportive environment for them. And that one was passed as it was brought forward. So SB 80, this created a Handle with Care program, and it was intended to address children who have been impacted by trauma and had some sort of interaction with law enforcement. It was to bridge the gap between schools and resources. So for example, if a child had interaction with law enforcement because of a domestic violence case or otherwise, law enforcement would be able to reach out to the school, say, hey, we had an interaction with this kid. Please be sure that you guys can provide them services. And then the school would be able to bridge that gap. And the bill details the requirements, the notification, how that would happen after the traumatic event. So the next bill, SB 147, this one is to help homeless, unaccompanied, or foster care youth. They often face unique challenges that impact their ability to graduate on time, whether it's moving often or if they don't have a safe place and it causes increased absenteeism. Those are some of the examples. The bill offered flexibility to schools to offer partial credit and eliminate some of the barriers to high school completion. So it was really helpful in allowing these youth to graduate because it could help bridge some of their issues and still get them on their way to getting their diploma. AB 111, also brought forward by Assemblywoman Monroe Moreno, is to study the welfare system. So it was to dive into federal funding opportunities in Nevada and to conduct a cost-benefit analysis of the Unity system, which is the statewide child welfare case management tool, to see how that's faring for our caseloads, to see if it's providing the service that it's intended to. And the report for that one is available as well. Next is AB 439, and this one was to remove burdensome fees to families going through the juvenile justice proceedings. So it was passed to remove the fees. It would keep fines and restitutions, so the family would still have to pay that. But what they found was that in Nevada, although these fees were being imposed, insignificant amounts of them were actually being collected. It resulted in very low revenue to the state, but it did put a high economic burden on these families, so those fees were removed. So next, going on to the subject of school readiness. SB 84, and this one was brought by Senator Woodhouse. It was to establish a pre-kindergarten program as funds were available. The original bill would have required the Nevada Department of Education to fund and form the account. However, it was changed to just have the account and then have it funded as available. So that one's pretty straightforward. AB 234, this one was brought by, pardon me, again, Danielle Monroe Moreno, Assemblywoman Monroe Moreno, and this bill was to have the Division of Welfare and Social Services increase the amount of child care providers for children specifically with documented disabilities. The intent was to improve the child care subsidy program for families in Nevada and to help support that realm. Additionally, the bill would allow for parents who are currently receiving the subsidy assistance to continue to receive it if they return to school. We can go on to the next slide to discuss some child health. Thank you. So SB 90, this bill changed quite a bit. In the end, what it ended up having was it updated the reposting requirements regarding the amounts of levels of lead in children's blood. By doing this, it lowered the threshold of what was required for reporting so that more reporting was available and more data was available to review in greater detail the impact that this would have on children's health and well-being. And additionally, it also created the diapering resource account. Originally, again, that was supposed to have an appropriation that was removed, and essentially it was created to have the account as funds are available. So SB 198. This one we're going to go into detail a little bit further later, so I'll just give a quick overview. This is to conduct a study on why Nevada children may be losing Medicaid coverage over a 12-month period. Obviously, the intent was to see why there are gaps in coverage and review the fiscal impact of what it would be if we were to provide that coverage. So the report is available and it's linked on the handout, and we will also hear a brief presentation on that later and what the future of that might be. So going on to economic well-being, the census in 2020 was really critically important. And over the next decade, lawmakers are going to use this data to make critical decisions. The result of the census shows where communities really need new schools, clinics, new roads, more services for families, older adults, and children in general. The results will also inform how hundreds of billions of dollars in federal funding are going to be allocated to more than 100 programs, including Medicaid, Early Head Start, SNAP, and other programs like that that help support Nevada families and their children. So CAA in general supported bills and efforts to increase the outreach. So we really wanted to make sure that every child and every adult were counted so that we can really focus on getting those funds to the communities that need them. So really, finally, one of the main takeaways is that the 2019 session provided a lot of data from some of the bills that we got. And many of the bills were trimmed down from their original intent, but one of the positive results is that by requiring data collection, CAA can use this information to advocate with more detail and clarity around the topics, and hopefully it'll help strengthen our advocacy positions and move forward into 2021 more effectively with what we want to accomplish. So that was an overview of the 2019 bills, and with that, I'm going to turn the presentation over to Jeanette, who will discuss CAA's 2021 session priorities.
Thank you so much, Valerie. As in 2019, CAA's 2021 session priorities align with the policy areas that are the foundation of their work. In the area of child safety, next slide, please, the Legislative Committee on Child Welfare and Juvenile Justice, under the leadership of Senator James Orenshaw, included Bill Draft 502 in its recommendations to the 2021 legislature. This bill draws on the work of the AB 150 working group established by DCFS after the 2019 legislative session, comprised of 69 members, including the child welfare jurisdictions, attorneys who represent foster youth, service providers, advocates, former foster youth, and others. This committee met during the interim to evaluate the benefits of the Title IV-E reimbursement for extended foster care to age 21. Approximately 160 Nevada youth age out of the foster care system every year. Nevada currently has the Voluntary Court Jurisdiction Program and the Fund to Assist Former Foster Youth. BDR 502 would allow Nevada to opt into the federal program while maintaining current foster care programs. There is still more work that needs to be done to understand the financial implications of this bill draft, including what new revenue would be available, as well as what new costs could be incurred to implement the 4E reimbursement. This bill draft allows that conversation to continue with more information to be discussed at the session. As Deshaun Jackson mentioned earlier, CAA hosts a quarterly Child Welfare Network meeting and will continue to work to provide output on this issue. One thing is for certain, everyone is committed to an outcome that generates more net funds to assist these youth. Legislation to improve children's health is a large component of CAA's 2021 legislative agenda. Dr. Baumgartner stated earlier, decreased access to care produces adverse health outcomes for Nevada's children of all ages, even those not yet born. And Priscilla Acosta outlined the collaborative work with the Pritzker Children's Initiative in this priority area. The Legislative Committee on Healthcare embraced children's health and recommended several bill drafts on that topic. Before I review these bills, I would like to turn the program over to Chair Leslie Cohen, who will offer a glimpse into her committee's work. Thank you so much for taking time out of your day this morning, Chair Cohen.
Thank you very much. And good morning, everyone. Thank you for the opportunity to speak with you today. I appreciate this opportunity to share with you the important work we did during this last interim to set the stage for the 2021 legislative session. Again, my name is Leslie Cohen and I represent Assembly District 29. I had the pleasure of chairing the Legislative Committee on Healthcare, and despite the pandemic, we were able to have 8 very productive meetings and discuss very important topics, including public health, oral health, COVID-19 response, food insecurity, and children and maternal health, among other issues. The committee's charge is to hear testimony regarding all these subject areas and distill them down to just a few bill draft requests. And it's a challenging process because there are so many worthwhile topics. I'd like to highlight a small portion of our work for you today. As you know, Nevada's Medicaid covers almost 60% of the total births in our state, and that's pursuant to 2018 data. So public policies that we discussed will impact many moms and babies, over 20,000 based on 2018 data. According to data presented by the state, Nevada's rate of uninsured women of childbearing age is over 15%, and that's above the national average of 12.3% based on 2017 data. Currently, Medicaid covers women up to 165% of the poverty level, and the national average is 200%. 8.5% of babies born are of low birth weight. 8.2% of women receive late or no prenatal care. 76% of moms who died within 1 year of giving birth are on Medicaid. There's abundant room for Nevada to improve coverage and access and positively impact outcomes. These statistics are why the Health Committee approved BDR 452, which will address several Medicaid eligibility options, which if passed will help to lift Nevada from the bottom of the national health rankings. We also discussed healthcare workforce development at length. We heard testimony about the role of community health workers, or CHWs, in the promotion of health and the prevention of chronic disease under the oversight of a Nevada licensed healthcare provider, such as a physician, APRN, or a physician's assistant. The state reported that Medicaid could use CHWs in the delivery of services such as maternal child health, among other things. The committee considered the value that CHWs provide the healthcare system and proposed BDR 449 to require Medicaid to reimburse CHWs for their service. The committee, and also, just so you know, you can find out more about these and other BDRs passed through the Interim Health Committee in Bulletin 21-19. Just copy. But you can also find that on our committee's page on the Nellis portion of the Nevada legislature's website. I appreciate your time today, and I'll turn the program back over to Jeanette, who will review these proposals in greater detail. Thank you.
Thank you so much, Chair Cohen. I would first like to address the interim committee's BDR 449, which requires Medicaid to reimburse for services provided by community health workers. They deliver important services on the front line, including in schools, community-based organizations, medical clinics, and through home visits. CHWs support families with children, especially those from vulnerable and high-risk populations. They assist new moms with education, referral, adherence to healthcare provider recommendations, and navigating health insurance options and more. Medicaid testified that allowing for CHW reimbursement would have an immediate offset to the cost of these services in other areas. So, for example, the rate of preterm births and low-weight babies could be positively impacted because pregnant women could be assisted by CHWs to connect them to services and resources earlier in their pregnancy. BDR 452, as recommended by the Legislative Committee on Healthcare, has several components related to Medicaid eligibility. Medicaid is the largest payer for births in Nevada at nearly 60% of births in 2018. Medicaid currently covers pregnancy-related care, but additional eligibility options for pregnant women would help improve access to needed prenatal and postpartum care. First, eliminating the requirement that lawfully residing pregnant women must have lived in the United States for 5 years before being eligible for Medicaid is included in BDR 452. 25 other states have adopted this coverage. This option is available by a state plan authority. Secondly, expanding Medicaid coverage to 12 months of postpartum care can help address our infant mortality rates and increase access to vital mental health services. It would also promote continuity of care during the first year after delivery. And third, presumptive eligibility would allow qualified entities such as hospitals, health departments, and federally qualified health centers to determine eligibility and then immediately temporarily enroll patients in Medicaid. This would not only provide instant access to care, but also begin the Medicaid application process. I would like to pause here for a moment to introduce Assemblywoman Michelle Gorlow, who also has Bill Draft number 130 that addresses Medicaid presumptive eligibility. Assemblywoman Gorlow previously worked with the March of Dimes and is now the Vice President of Business Development and Community Relations with Positively Kids. Thank you so much for joining us today, Assemblywoman.
Thank you so much for having me today. I'm really excited to be here and to talk about presumptive eligibility. As previously mentioned, I do represent Assembly District 35 in Las Vegas. I currently work for Positively Kids, which is a nonprofit organization that provides health services to children with an emphasis on children who have special health care needs. Many of those children are born preterm or with complicated births. Prior to that, I was with March of Dimes for 15 years, where I actually started working on presumptive eligibility issues back in around 2005, 2007 legislative session. And that's what really drew me to want to be a legislator, is to improve access to healthcare for pregnant women. Much of what I have to say is going to be repeating what some others have already talked about. But to recap, presumptive eligibility would presume that a woman who is pregnant is eligible for Medicaid services while her application is being processed, so that she can see the doctor as soon as possible. And that early prenatal care is really vital for the health of that pregnancy and for the mom. That's the care that's taking part in the first trimester, so between the 1st and 13th week of pregnancy. And that gives the doctor the opportunity to look at any sort of baselines, find out if the woman is pregnant with a singleton or if it's multiple births, find out when there's a due date. Talk to mom about healthy eating, healthy habits. If she happens to be smoking, start smoking cessation treatment. Look at if she has gestational diabetes or any other chronic illness, and of course, testing for infections that she might have. As we have already heard, our early prenatal care rate is roughly around 74.6%, depending on which organization you look at. Nevada is ranked probably in the last 10 of the states, again, kind of depending on which organization you look at. Some of us have us right around the 40, 42 mark, and a couple had us around 38, 39 when compared to other states. The goal for early prenatal care is also 80.5%, and currently when we're at about 74.6, we are lacking in that. When we're breaking it down by race, we can see it Native Americans are the lowest population receiving adequate or early prenatal care at 54.7%, with African American women being next at 70.2, followed by Caucasian women at 74.7, and then Asians at 76.1. Then when you tease out the ethnicity, Hispanics then come in at about 70.5%. Our current preterm birth rate in Nevada is about 10.4%, with a goal of being less than 8.1%. So right now we have about 1 in every 7 babies being born preterm, with the average cost of a preterm birth being approximately $65,000. So by having these women access early prenatal care and taking care of some of the risk factors involved, it is our goal that we will reduce the preterm birth rate, but not only reduce preterm birth rate, but look at moving some of the preterm births as well, so that a baby that's born at 32 weeks could possibly be born at 34 or 35 weeks. And so that would, again, reduce the cost of preterm birth, and then hopefully also reduce any long-term disabilities that a child might have being born preterm as well. You know, again, most of the information about presumptive eligibility has been said already, so I will turn it back over to Jeanette and answer any questions you might have.
Thank you so much, Assemblywoman Gorlow. And I'm going to tell just a little bit of a story that you and I chatted about yesterday. We had the opportunity to meet yesterday, and I found out, which I didn't know before, that Assemblywoman Gorlow decided to run for the legislature because she was so passionate about presumptive eligibility. So we love to see advocates become legislators, because that's how we move a policy objective forward. So thank you so much, and I hope you don't mind that I shared that.
No, thank you for sharing. And it is so exciting on my end to see so many people really championing this cause. Because when I was first bringing it up to the legislature, it was an empty room. And so having more and more advocates up there is just really exciting. Brings tears to my eyes.
Wonderful. Thank you so much for being here. Lastly, in the area of children's health, we have BDR 56, which is being introduced by Senator Melanie Scheibel. We're very lucky to have both Senator Scheibel and her intern, Talia Pellegrino, on Zoom to review this BDR and how it relates back to SB 198 from the 29 session. I'm going to turn it over to Senator Scheibel. Thank you so much for joining us today.
Thank you. Did I get my video and my sound on?
You're good.
Okay, great. Well, thank you guys so much for having me. And I am honored to serve in Senate District 9, which includes Assembly District 35, where Assemblywoman Gorlow sits. And she inspires me to keep helping kids and pushing forward an agenda that prioritizes their health. And that's why I am so passionate about ensuring that kids who do qualify for Medicaid stay on Medicaid. No child who needs critical health care should be denied that care or that care shouldn't be stopped or they shouldn't be left behind at any point in time. And so that's why I brought a bill last year that we talked about, SB 198, to ensure that every kid who qualifies for Medicaid is enrolled for a full 12-month period. We learned during the course of the last session that we didn't have all the data that we needed to make that happen. And so we started gathering that data, but it was too much for me to handle by myself. So I have been very, very lucky to have the assistance of an incredibly talented and bright young Master's in Public Health student, Talia Pellegrino. She has been the brains of this operation, reading through and understanding and questioning and analyzing all of the data that we've received so far in order to formulate the best policy moving forward into the 2021 session. And so I am very excited and very proud to turn it over to her to give all of you guys the policy perspective on this and a summary of what we've learned and what we're going to do going forward.
Thank you for the introduction, Senator. I really appreciate the opportunity to be able to share what we have been working on for the upcoming session. Bill Draft Request 56 is concerning Nevada children when it comes to current Medicaid eligibility guidelines associated with income requirements. So we are hoping to allow Nevada children who are 18 and under to have 12 months of consistent Medicaid coverage from the date that they're initially deemed eligible, even if their household income slightly shifts over the income eligibility guideline in place. So I'll start by mentioning that the purpose of creating and presenting this bill stemmed from the realization that children in Nevada are potentially not receiving the healthcare that they're entitled to. This is unfortunately an issue that has persisted in Nevada for the last several years, as we have had and continue to have a higher percentage of uninsured children than the United States average. It is crucial that we continue to make efforts to break down some of the barriers that are causing Nevada children to lack a source of care and in turn have unmet health needs. Senator Scheibel had acknowledged this as a significant issue for Nevadans and therefore began to work towards keeping Nevada children covered by introducing Senate Bill 198 during the 2019 legislative session. In that attempt to get Senate Bill 198 passed, the purpose of the bill was to allow Nevada children to be guaranteed 12 months of consistent Medicaid coverage from their initial enrollment. The bill did come with a higher than desired fiscal note because it was focused on any and all reasons for a child being dropped from Medicaid, which can range from the child leaving the household to a voluntary withdrawal or excess income, even unspecified reasons. So at that time, the Nevada system was not well equipped with appropriate technology that would allow, that would provide a detailed breakdown of data reflecting the specific details of why children were losing their Medicaid coverage. With a lack of data regarding the number of kids that were being disenrolled and re-enrolled and the reasons for that, it was difficult to conclude the impact of Senate Bill 198, what impact it could have and at what true cost. Therefore, it was passed with the purpose of upgrading the Nevada Division of Welfare and Supportive Services system in order to pull data that would give a better understanding for and breakdown of the problem of children being dropped from Medicaid and the cost to fix that problem as well. So DWSS has been able to provide a data analysis that focused on a handful of reasons for children dropping from Medicaid coverage, as well as a provided associated projected fiscal analysis for those various reasons. This data will be used to prepare a new bill for the upcoming session, which will reflect a similar policy that was initially presented with SB 198, as far as allowing children 12 months of consistent Medicaid coverage once deemed eligible. However, we've directed our focus just on the excess income aspect that causes children to be disenrolled from Medicaid. meaning Medicaid coverage is provided to low-income adults and children whose modified adjusted gross income sits at about or below 138% of the federal poverty level. This reflects an annual income of about $36,000 for a family of 4 in 2020. So the downfall with that guideline is if a parent were to receive a bonus check or get a new job making a slightly higher income amount, their federal poverty level then begins to fluctuate, in which that potentially causes their Medicaid coverage to be dropped due to being over the allowable income amount, in which case the child would also lose their Medicaid coverage. Out of all the reasons that we're seeing children being dropped from their Medicaid coverage, this is one we really see as a downfall with current guidelines, as families who are of lower socioeconomic status tend to have substantial fluctuations in their month-to-month income. Therefore, Medicaid becomes really unpredictable for those families. So being able to now have a better understanding for the specifics of why children are dropping off of Medicaid and how much it will cost to keep them on for 12 months of consistent coverage, we're hopeful that Bill Draft Request 56 will be more realistic with a refined fiscal note and still be seen as a very purposeful change for Nevada children to better meet their health needs, being at such a crucial stage in life of growth and development. As far as where we're at in the process, we are currently working to get this drafted, and therefore we do welcome any feedback, questions, concerns. I'm sure I can speak for Senator Scheibel as well when I say we're both very appreciative of Children's Advocacy Alliance allowing us to share these details with you all and for their continuous collaboration and support in bringing this to the 2021 session. So please feel free to reach out to me at any time regarding this matter. I'll be happy to share any additional details that we have or answer any questions prior to next month. My email should be provided on the slide, and I appreciate everyone for their time.
Thank you so much, Senator Scheibel and Talia, for your commitment to bringing this refined bill concept forward again. Next slide, please. In the school readiness policy area, CAA advocates for an increase in the state's contribution to the Child Care and Development Fund so that low-income families receiving public assistance and those transitioning from public assistance can obtain child care so they can work. As Dr. Sandra Owens mentioned in her presentation, child care is directly tied to economic recovery. And Annette Dawson Owens invited you to share child care provider stories throughout the pandemic to increase awareness and understanding for this essential component of the community's well-being. The policy area of economic well-being and the families will, and their, I'm sorry, I'll start over. The policy area of economic well-being of children and families will be extremely important during the 2021 session. CAA understands that the state budget is very tight, and Dr. Rains described the pandemic has had tremendous negative economic impact on families' security that are relying in greater numbers on services such as housing and food. It is CAA's high priority to ensure that Nevada does not make any significant cuts to programs that are supporting children and families during this economically stressful time. The governor's budget will be released in 1 week on January 18th, and he will deliver his State of the State address the following day. We are only a week away from having details on the governor's priorities. In closing, we are ready to roll up our sleeves and get to work. Our legislature is scheduled to convene on February 1, 3 weeks from today. Next slide, please. That wraps up our high-level overview of CAA's legislative priorities. CAA will be monitoring other bills and providing input, data, testimony to the legislature. We encourage you to track what's new during the legislative process at leg.state.nv.us and follow CAA on Twitter at CAA Nevada and other social media platforms. You can also sign up for their newsletter at caanv.org. And now Dr. Tyler Garner will open up another question and answer period of the program. Thank you.
Thank you, Jeanette. Before we pivot to more questions, I want to take a moment and specially thank Senator Scheibel, Assemblywoman Cohen, and Assemblywoman Gorlow for their advocacy, vision, and commitment to Nevada's children and family, particularly in these areas of healthcare access, understanding the needs of our youth transitioning from the foster system and other services that are vital to not only just our overall well-being, but even more critical during this time with this pandemic. And now I'd like to respond to some of the questions that we had in the chat on Facebook. There are a number of questions around things like, hey, what resources are out there for families, particularly if they are a family with a child with a special need, maybe even an older child, and wanting to advocate for themselves, or things like, how do you get engaged or volunteer with CAA? And does CAA work with other organizations? So as a general overview, I want to note that if you have questions about the work or opportunities to get engaged, I want to underscore what Jeanette noted, which is please be sure to go to our website at www.caanv.org. Also, if you're ready to roll up your sleeves and begin working with us, that you can send us an email directly to the organization at info@caanv.org, but also on our website, each policy director is listed. And so we encourage you to review our areas, which include health, early learning, economic well-being, and safety, and email each policy director directly as a part of the commitment to partnering with us. Beyond that, we currently facilitate a number of coalitions. And so I'd like to give each policy director just an opportunity to share again some of the coalitions and to share one that's evolving on the horizon. And so if I could have Dr. Kelly Baumgartner share about the Nevadans Together for Healthcare Access, kind of when do you meet? What is it about? What are some of the things that you all are tackling together now? Dr. Baumgartner?
Thank you, Dr. Tyler. The Nevadans Together for Health Access Coalition meets at least once a month, sometimes a bit more frequently, depending on what issues we might be addressing or advocating for. We recently hosted a presentation on managed care organization transparency in Nevada by the Georgetown Center for Children and Families. That was very interested and very well attended. Sometimes we are fortunate and honored enough to host speakers like Senator Scheibel has spoken to our coalition before about some of the BDRs that are healthcare related that she may be looking at or working on for the upcoming session. So we would love to have you join us. You can visit our website at nvforhealthaccess.com. We also have a Facebook page, NV4, the number 4, Health Access. And you're welcome to email me and ask any additional questions and put yourself on our email list for upcoming meetings. So if you'd like to send me an email, I'd be happy to facilitate that as well.
Thank you, Dr. Baumgartner. Ms. Acosta, could you share a little more about exactly who is participating in the Pritzker Initiative? How often are you meeting and what's on the horizon for that group?
Absolutely. We are currently in the extended planning process for the Pritzker Children's Initiative grant. Our grant will be going to the Pritzker's Foundation at the end of this month. We have one more leadership meeting that's taking place on January 28th, where we'll be presenting the full grant plan that we'll be submitting to the Pritzker Foundation. After that, we'll be hearing in February whether or not we'll be moving on to the next round of implementation, which all fingers crossed, we'll be moving that direction. At that time, any members of the public are welcome to join one of our 4 work groups that are focused around Medicaid, community health workers, home visiting, and childcare. And so again, if you'd like to join any of those work groups, please feel free to reach out to me, or you can just be a member of our full collaborative and attend what I believe will be monthly meetings where we hear updates on all of those work groups. So just visit our website or reach out to me through our website, and I will be happy to get you more information how you can become more active in expanding services and programs for prenatal individuals and infants and toddlers in our state.
Awesome. Thank you, Ms. Acosta. This is Dawson Owens. Could you share a little more about some of the coalitions that you're facilitating, particularly the childcare industry?
Sure, Dr. Tyler, I'd be happy to do that. We have been hosting a bi-weekly early learning COVID call that works with people across the state, including childcare licensing, the Urban League, the Children's Cabinet, the NICRP, the Department of Ed. And so we hold these calls bi-weekly on Tuesday to make sure that we understand the needs that are happening there across the community, and to make sure that we are aware of how we can support and opportunities that are available to provide services for children. We also are creating a constituent council with experts in the field who will also work in advocacy efforts to expand CAA's reach. And we will partner with different organizations and groups to advise us in how we can best serve children. We are creating a birth to pre-K to onto grade 12 continuum. We view it as a continuum, and we have many longstanding relationships with others doing this work in the community.
Thank you, Ms. Dawson Owens. If I could also ask you to speak to the Strong Start Governors Initiative. Someone in the chat had a question about how youth can get engaged.
Sure, we are so excited about our Strong Start Governors Initiative. We had youth that were in grades 4 and grade 5s try out to be the Strong Start Governor, and one was chosen. These were such incredible youth who talked to us about how their voices are so important and how they have solutions and want to get involved in their community. And so each of us at the Children's Advocacy Alliance has a partner, a mentor that we work with, and we listen to these youth and we hear about the things that they're facing, and we find ways that we can connect them to community partners, and ways that we can also help them advocate with us and share their stories. They're closest to this work, and so their voice is so important, and it has been a great addition to us. And we are excited as we move forward every month working with them and finding opportunities for them to serve and share their knowledge with us. And we expect great things to come from these youth and share them more with you in the community as we're going forward.
Thank you, Mrs. Dawson Owens. Mr. Jackson, if I could have you share just a little more about the Child Welfare Network and when those meetings are, the next meetings are held.
Yes, give me 1 second. I am having just some issues. I facilitate a Child Welfare Network meeting, which is, I facilitate a Child Welfare Network meeting, which is a group of community providers from across the state. We host two, one in the north and one in the south, quarterly, and those coalitions focus on ways we can improve the foster care systems, the child welfare systems in both the north and the south. We recently expanded, as I had stated before, to Northern Nevada to ensure that we are capturing the entire voice of the entire state. So we are continuously trying to work on bringing together and ensuring that we have a collective voice for Nevada's foster youth and in the child welfare systems.
Mr. Jackson, I believe our upcoming meetings are on the 27th and 28th of this month, respectively, at 9 a.m. Go to the website if you'd like more detail and hope to join us. And then as a part of this conversation, this notion of, hey, are you committed to partnering with others and how do I get engaged? It's important to note that at the core of our work, we see our priorities as increasing awareness and amplifying the voices around the issues that impact children and families in Nevada. And as a part of that work, we welcome partnership. I hope you heard that under each priority area, there is a coalition meeting that is comprised of many stakeholders, where our vision is working across systems and within them to ensure that children and families are supported to success in our state. As a part of that process, there are a number of initiatives on the horizon for us. So we are fleshing out what it means to ensure economic well-being for children and families. So looking at things like housing, food insecurity, the impact of unemployment, and because we are committed to leveraging the best that we have to offer as a state, are asking partners in those areas to reach out to us as we reach out to them, to ensure that there is really a true, strong safety net for Nevada's children and families as a part of that process. We are also committed to being timely and responsive. And so we not only have our hand on the pulse, but are looking for ways to ensure that we do so, whether that's partnering with you to convene town halls or forums around particular issues, conducting focus groups or surveys to get a better understanding, whether you are a legislator on this call, a community member or leader, or a nonprofit organization. We really believe that Children's Advocacy Alliance should be that, an alliance, allies working together to improve these conditions. And so now I'd like to pivot and say, on behalf of the Children's Advocacy Alliance, thank you to everyone in attendance today, including every legislative leader and community leader who made time to join us for this important discussion. I also want to give a special thank you to not only our special guest, Senator Catherine Cortez Masto, but also our legislative leaders, Senator Scheibel, Assemblywoman Gorlow, Assemblywoman Cohen, our board chairman, Lynn Perdue, Lauren Brooks and Associates, who made this event possible, J.K. Belson Associates, and the entire CAA family. I also want to affirm how empowering it is to see so many gathered on this call today, either by Facebook or by Zoom, because the work is important. And before we close, I want to underscore that there's a critical role each of you can play in ensuring a bright future for Nevada's children. As a part of that process, or wanting to underscore the next step that you can take with us, I'd like to introduce Patty Oya with the Nevada Department of Education, so that she can share a very special screening we have to close this program today. Ms. Oya, are you there?
I am. Thank you so much. Good morning. My name is Patty Oya. I'm the director of the Office of Early Learning and Development for the Nevada Department of Ed. I'm pleased to introduce this showing of the documentary, Starting at Zero. The idea that education begins at birth and not at kindergarten has been embraced by the department and the state superintendent, Joan Ebert, as evidenced by the first goal in our 2020 statewide Plan for Improvement of Pupils, also known as the STIP. All children, birth through third grade, have access to high quality early care and education. So that really highlights the importance of early childhood within the department. With the 2021 Nevada legislative session right around the corner, this documentary highlights the power of fully investing in high quality early care and education. Did you know that Nevada only serves 8% of all eligible 4-year-olds in the Nevada Ready State Pre-K program? These are children from families who are at or below the 200% federal poverty level. While increasing funding for pre-K may seem like an insurmountable task during this difficult economic time, it becomes even more important as families need access to and support of high quality programs to return to work to ensure Nevada's economic recovery. Most importantly, Nevada's youngest children deserve the opportunity to thrive and achieve their full potential. I'd like to thank Dr. Tiffany Tyler Gardner and her team at Children's Advocacy Alliance for supporting this screening and recognizing the importance of high quality early care and education. I would also like to thank everyone who is virtually attending today. I hope this documentary touches your heart as it did mine. Please enjoy. Thank you.
Now we'd like to ask you to join us for a showing or screening of this important film.